landlords. If you're speaking to your landlord and they know that you're applying for county rental assistance funds, you may be able to work out arrangements to not disrupt your living situation. So we encourage you to do that. For more information about this program, maricopa.gov/COVID rent help. maricopa.gov/COVID rent help. Or contact your community action agency, which is also on that website. You'll be able to see all those communities I named earlier there and understand how to contact them. Thank you.
Thank you so much, Bruce. A lot to unpack in that statement. There was a lot going on there. So again, we'll have time for questions and answers here shortly. I want to give you an update right now, though, on the business grant, small business grant program, and it also includes nonprofits as well, which I think is important. This is important to members of our Board of Supervisors when they created this program. Maricopa County and the Board of Supervisors specifically, the primary focus has really been on the health emergency ever since it came to be when we had our first case in January. The board understands, though, as everybody does, and what Bruce was talking, there's a huge economic impact going on in our county and all of our communities. The county typically supports economic growth in different ways than cities do, through balanced regulatory policies, not direct support business. So this was a new frontier for the Board of Supervisors and for county staff as well. So we have a partner in this in the Arizona Community Foundation, but I'll give you a quick update for how the small business grant program is working right now. Since Thursday, when this launched, we've had 110 applicants already approved and receiving money. The total amount of grants as of today is $893,000. That's in just 4 business days that has been granted to various nonprofits and small businesses. So if this is the first time you are hearing about this, I'll go through some of the basics about this program. It provides a grant up to $10,000 to small businesses, nonprofits that have been impacted by COVID-19. We're using $23 million in CARES Act funding to pay for this. This is on a first-come, first-served basis, and this includes all businesses and nonprofits outside of Phoenix and Mesa. The same, for the same reason that Bruce explained on the rental assistance program, Phoenix and Mesa, both very large cities, also received CARES Act funding. They also have business support programs as well. So the applications, they started being accepted last Thursday, and I'll give you the website really quickly, but it was in our press release and website, azfoundation.org/Maricopa Relief. And to qualify for this, a small business or a nonprofit has to have fewer than, or 25 or fewer full-time employees, saw gross revenues decline by 25% in March and April from the previous year. Also did not get any other COVID-related government assistance to stay afloat during this time. So if you have any questions about that, I'm happy to answer that. This is the portion where we'll open it up to questions and answers. It looks like Sarah is well over here with her new mask that we were able to provide, so we appreciate her assistance today. Once again, Bruce is open to questions about rental assistance. I'll do my best to answer questions about the grant program that is ongoing, but it certainly seems to come out of the gates very quickly. So, Chad, do we have anybody on the line?
We do. Nicole Grigg has a question.
Okay.
Nicole, your microphone is self-muted. There you go.
Okay, I think I got it open.
Yeah.
Sorry, I missed the very beginning because I had troubles logging on. Is Dr. Sonnenschein here? If not, Fields, could you please address what is happening inside the medical examiner's office? As of Friday, it was at 96% capacity. We're now hearing that funeral home directors are getting calls from the ME asking if they have cooler space. You guys only had 6 spots available for bodies on Friday. What's happening today, and what are you guys doing to add capacity?
Happy to do that, Nicole. That doesn't really involve Dr. Sonnenschein, but I can answer that question on behalf of the medical examiner's office and the Unified Command. So as of Friday, we are at 96% of normal capacity. Normal capacity is 150 decedents. But we have a surge capacity up to about 209 decedents. So really, we were in the 70th percentile range. So at that point, we have seen a larger number of decedents over the last few weeks. This is a cause of concern, but as of today, we are at 156 total sedents out of that 209. So that's 78% of our total capacity. That said, that puts us into a range of surge. We're entering our surge capacity, and as we had planned for, if we needed to, we already had contracts in place to deal with this and bring in portable coolers as necessary. Because we don't want to hit any sort of capacity situation, we have placed orders and should have portable coolers in place either today or tomorrow. 4 coolers have been ordered initially, with more potentially being ordered in the next few days. 4 coolers will give us extra capacity for 60 bodies. And again, I explained this a lot on Friday, but I'll say again, this is to deal with capacity at the medical examiner's office. I think it's important to note that this is an entire system. Hospitals have coolers, funeral homes have coolers, medical examiners' offices have coolers. So bodies come into the medical examiner's office, they go out to funeral homes after autopsies are performed or investigations have begun. So it's important that this entire system is working properly. Yesterday, because we hit that surge capacity, multiple phone calls were to funeral homes all over the county to try to assess that their ability to make sure they were taking bodies in a timely fashion so the medical examiner can keep doing the great work that they're there. With that, I'll turn it over to Joanna Molina to translate really quickly, and then we'll get to the next question. Thanks for the question, Nicole.
La pregunta es, ¿qué está pasando en la oficina del médico forense? Si 96% de trabajando con las...
To the first part of your question, which is a general status update. And what's important to know is that we had just over 2,700 cases in the last 24 hours. And what we're seeing is that our average number of cases is right around 2,500 cases per day. And that is slightly decreased from what we were seeing right around the 3rd week of June, when the mask requirement was initiated by Maricopa County. That was also around the time that the governor closed bars and gyms and did some other things. But what we found is that just about 2 weeks after those events occurred, we started to see a decrease in the number of cases. And that is what's referred to as a slight flattening of the curve. What we don't know for sure is how prolonged the flattening will be. We hope that it will continue to decrease, although it's much more clear that it is flattening right now. And we do anticipate that we're going to see a flattening or a decrease in hospitalization data coming up in the next 1 to 2 weeks, and then followed by 1 to 2 weeks later, hopefully a flattening and a decline in the death rate, because those always lag a couple weeks behind each other. So that's our general status update. I can't comment on the specific study that you referred to, simply because I haven't read it in full, and I'm certainly not one of the co-authors. What I can say is that the general concept of knowing that if you're going out in public in a large group of people, there is a high likelihood that you will be exposed to COVID-19. Wearing a mask, we've gotten much more evidence even over the last few days that wearing a mask definitively can prevent you from getting COVID-19. It's not perfect. Distance is always going to be, but masks work very, very well, and we've got good data to show that wearing a cloth face covering will actually prevent you from getting disease most of the time.
La pregunta es de una actualización acerca de COVID-19 y también acerca de un estudio que ha salido de los datos de Georgia, que demos nuestra opinión en cuestión de salud pública. Contestando la primera pregunta en cuestión de los números y la actualización en el condado de Maricopa, aproximadamente se ven 2.000, ha estado bajando, pero creemos que COVID-19, con el uso de la mascarilla.
Can you hear me?
We can.
Okay, I've got a couple of questions for you. The first is that the county got this money in April, the CARES Act money. It is now July. Could you please talk about what the 3-month delay was in getting this money out? And my other question is, do we have the authority to put a moratorium in place in the event that the governor allows his executive order to expire, the one that postpones evictions?
So just to clarify, Courtney, you're asking if the board has the authority to do an eviction moratorium similar to what the governor has done by executive order?
Exactly.
I can't answer that, lawyer, but I'm looking at Bruce. Have you ever explored that? We'll have to get back to you on that, Courtney. There are a number of things the Board of Supervisors can do, but I would just be speculating as to whether or not they have that power under state law. I don't know that without researching that. As far as any sort of delay, as I explained to you in my email today, yes, we, along with Phoenix, Mesa, the state of Arizona, Pima County, they all received CARES Act funding in early April. At that point, the Maricopa County was already spending a great deal of standing up, helping the Human Services Campus, for example, efforts to create separation for people experiencing homelessness, renting hotel space, motel space, to allow people who either were at risk or sick to have a place to go so they weren't congregating on the Human Services Campus or any other shelter environment that was out there. We were also pouring a great deal of effort through public health into long-term care facilities, disease control, that sort of thing. So all these things were going on in March and April before the CARES Act money arrived. So once it did arrive and we knew how much there was a lot to consider here because Department of Public Health. No other cities and towns in the state of Arizona have a Department of Public Health. So it's up to counties. They have the Department of Public Health, and there's the state level, of course, with Arizona Department of Health Services. So in coordination with them, what are we going to do with this? Is the state going in and help cities and towns that didn't get CARES Act money? So any city and town under 500,000 population did not get CARES Act money. So ultimately, it was decided by the state to share money with those cities, and so they were able to address issues particular to their location. And so at that point, the Board of Supervisors knew we weren't going to have a commitment to those other 24 cities and towns in Maricopa County, at least not with direct payments to them. So that gave us a better idea of how much money we were looking at. And as I explained, the wheels were already turning on many of these programs. How would we divide it up? Much of this we don't know. We've never had a pandemic in the modern era like this, of this size. We don't know what money we're going to have to spend next. So there's some money set aside. A lot of this money has been allocated into broad buckets, if you will. I mentioned 2 of them at the beginning of this. And then, as Bruce explained, he was already well on his way. He had staffed up to help release the money or approve applications for the state money that was provided for rental assistance or evention. And so he had some repurposed staff already doing that, and now we are implementing this program that was stood up in 6 weeks that would probably normally take about 6 months to do. You're talking about 11 different community action programs that are out there, and they are good partners in all this, but they had to be communicated with. They have to be partners that are brought into this. They know what the requirements are, and they're the ones that are going to be taking in applications and helping us approve those and getting people the help they need faster. So I hope that answers your question. Thank you. And I'll let Joanna translate that very long answer. Sorry, Joanna.
Bueno, son 2 preguntas. Si el dinero del condado llegó en abril, porque hasta ahora en fondos de CARES Act también se tienen que alquiler o evitar
BC 15 show today.
Yeah, hey everyone, I think you guys can hear me.
Sure.
Question for Dr. Sonnenschein, and I know you already addressed cases and deaths, what we might see in the coming weeks. Arizona's R number, I know there's a lot of people who look at this website who tracks that, and today it has Arizona finally in the green, under 1, I think it's at 0.97. Question is that good enough, and is there any indication in the data here in Maricopa County that would show, are the measures that are currently in place enough and sufficient enough to actually start driving cases down to a more manageable level?
Are we talking about the R0 measurement that's out there, Mike?
Correct, Fields. The site rt.live, I know a lot of people track that. It has
Sure.
Arizona under 1. So one of my questions would be, is that good enough? And are enough measures in place to see numbers start going down to a more manageable?
Okay, Dr. Sonnenschein will take that question. Thanks, Mike.
All right. Thank you for that question, and it's a really important question. We're all our numbers very closely. As I mentioned before, there's a couple of measures that were put into place right around the third week of June, including the mask requirement Maricopa County-wide, as well as of bars, gyms, and tubing, and some other things. And we know that it takes 14 days for those measures to take place. So at that 14-day period, that is exactly when we started to see a decline in our case number, as you mentioned, and what we follow very closely the R-naught that you discussed. The specific R-naught that you mentioned on that website, that is one of the data sources that we do follow, and I know that I have talked to a number of experts who think that estimate is reasonable, but you do have to know that all of those estimates are based on a lot of different data and a lot of different assumptions. So I don't put all my eggs in any one R-naught basket. I want to make sure that there is no universal R-naught. That being said, that is a reasonable site to go by. Our goal is to R-naught less than 1. As you said, that site is showing that it is slightly less than 1. And as long as we can keep it below 1, what that means is for every person who's infected, less than one other person will become infected from that person, which means that the curve by definition is going to go down and that we will eventually get to 0. What I'm hoping for is that we will see a stronger decline from those measures, and that as people start to realize that this is a big deal and wearing a mask really does help. And with these recent studies over the weekend, there was one with 2 hairstylists who actually were infected, and they looked at a number of their clients, and because they wore masks, not a single person got infected. So as more data shows how effective masks are, we hope that the community will take that into responsibility. We can continue to get that R-naught less than 1, and that we will eventually get there where we can suppress the spread.
Bueno, la pregunta es que si Arizona finalmente se está viendo la luz verde, si acaso para ver resultados. Y es lo que nosotros en este caso tratamos de poner, a pesar de que es...
There's a follow-up question for
Okay.
Director Liggett. Peter, your microphone is live.
Thank you. So if the eviction moratoria were extended beyond next Wednesday, or set to expire then, would this have any impact on the rental assistance program? Would the program be able to wait in some other entity, some other component of victims from the coronavirus crisis? Would they be getting help instead? Just wondering how this all factors and pieces together.
To be clear, Peter, you're asking if we would shift funding away from rental assistance if the eviction deadline would be extended by the governor. Is that correct?
That's correct.
Okay. Bruce will step in and answer that one. Thanks, Peter.
I think it's important to remember that the rental assistance program benefits not only the renters, but also the landlords who have mortgages to pay. And so I think irrespective of any continuation of the moratorium, it'd be important to know who's able to pay and who's not able to pay their rents, especially with the reduction anticipated in unemployment insurance at the end of this month. So I foresee this program continuing irrespective of a moratorium. It'd be good to get money in the hands of the landlord on behalf of the renters and strengthen that community. So that's how I see it.
La pregunta.
Thanks again, Peter, for the question. Chad, do we have somebody else with a follow-up?
We do not.
Okay. Well, that's all the questions we have for today. Is there anybody else on there, Chad?
There are no hands raised at this time.
As I look at the speaker. All right. Thanks, Chad, for your help with us today. Thanks, everybody, for joining us. We certainly appreciate it. I'd like to thank Dr. Sonnenschein and Bruce Liggett for joining us today. Great questions. We appreciate your time, and Joanna, too, for helping us out. So thanks again.
All right, guys, just want to say thank you for being here with us. This is a live look at our press conference that we're waiting on. So Florida Governor Ron DeSantis, he is going to be giving an update here in just a little bit. And so you can see we do have the press waiting as he's going to be in Tallahassee talking about COVID-19 numbers in the state of Florida. And remember, Florida is one of those states that is definitely a new epicenter of COVID-19 cases, and they have been strongly trying to combat and help their people safe. So we'll be bringing you to that update as soon as it does get started. So until then, we've had a lot of updates still happening all across the U.S. We will bring this to you live once it starts, but until then, I'm going to go to one that happened just a little bit earlier this morning. We had our DC coronavirus update with Mayor Bowser and also the other officials talking